adjusting the training approach in that community is the number one method of responding to such a change. And to recognize that you fit in because you fit in. You fit in not because, or you're successful, not because you're offering something that nobody else does, but that you're offering something that the community needs.
You're listening to Home Care Hindsight, the podcast where we talk with home care leaders about the big mistakes they've made and the even bigger lessons they've learned along the way. I'm David Knack, head of sales here at Zengage, and I've built a career on the idea that we learn a whole lot more from our mistakes than from our successes, which is great because I've made a lot of mistakes. I've gotten to know some of the leaders in this industry who've built amazing businesses and are super well respected. So I thought it'd be fun, instead of asking them about the great things they've accomplished, to have them tell the story of one of the biggest mistakes that they've made and how that mistake changed their thinking and the way they run their business. All right, we are back with another episode of Home Care Hindsight, brought to you by Zengage. Little commercial at the top. We've just launched our Scheduler AI service. I was chatting with one of our customers the other day. She shared, my latest shift started at 11 p.m. My earliest shift started at 6 a.m., so I never went to sleep before 11 p.m. I never slept later than 6 a.m. and really was excited to be able to offload some of the after-hours on-call responsibilities to our team, make that feel like a natural extension of her team, but give them the much-needed break in the way they need to. So if you're interested in that at all, go to our website, fill out a form, send me an email, david@zengage.com. Would love to chat with you about that. But let's get to the real show. I'm joined today by Fady Sahhar. Fady, thanks so much for joining the show.
That's great to be here.
For people who are not familiar with you, how would you introduce yourself?
I'm a person who grew up in the disability community. I'm a wheelchair user. And some people will be surprised that I speak 4 languages.
Yeah, very good. Well, I think the early part of my career was in the disability services world. I did fundraising, marketing for a nonprofit, served people with disabilities. And I remember the first time that I had conversations with people with disabilities, and those could be physical disabilities, those could be cognitive impairments, but it all, one of the things you shared is when somebody's standing next to somebody who uses a wheelchair, all the conversation goes to the person standing up and not the person sitting down. And so for people who, like myself when I first got into this world, felt super uncomfortable navigating the world of disability, I think many home care owners are finding themselves talking to folks who use assistive devices for the first time. What would you recommend to people to be, just a better person and feel more comfortable interacting with folks with disabilities?
Well, a person with a disability may have 1 or 2 things that don't work the same way your body works.
Right.
So treat them as a human being, engage them in the way you would engage any other person. What I find very interesting is folks have a tendency to want to look up or look down, look sideways, as opposed to talk to the person that's sitting in a
Sure.
wheelchair. So,
Yeah.
if you're in that situation, pull up a chair, put yourself at the same level. And just like you might talk with any other person, if you find the person sitting at a conference table, the tendency is to sit in another chair at the conference table. The
Sure.
person in a wheelchair is not likely to stand up to be as tall as you are. So make
Sure.
yourself accessible.
Yeah, makes sense. And I noticed you use the language of I'm in a wheelchair. I hear I use a wheelchair. I'm sure your favorite to hear is wheelchair bound.
Yeah, my favorite. And I have to tell you a little background story. When I first came to the United States in 1971, my favorite thing that happened to me was that I had to have some back surgeries at Shriners Hospital.
Sure.
Frame of reference, how far we've come. There was no person first language.
Right.
Shriners Hospitals, in their best intentions, were called Shriners Hospitals for Crippled Children.
For crippled children, which, I guess if you wanted to person first and keep the language the same, you could say for children who are crippled, but that doesn't help a whole lot.
Not a whole lot.
So we've come a long way, both in the adjectives that we use, but also the order of the language of person first, and then whatever disability or whatever use, person who
Absolutely.
uses a wheelchair, et cetera.
And I think that change or evolution is evidence of the amount of advocacy that has taken place.
Sure.
So people like you, David, and folks like us who are part of the disability community have had a long history of advocating for being included, for being part of the conversation.
Yeah.
And, nothing about us without us is very real.
Right. Right. Well, when we were chatting at a conference in California where we got to know one another, you were sharing with me some really interesting stuff about the advent of home care in Medicare. And so I want to hear a little bit more about that. Typically, Medicare is not something people think of as a payer source for home care. So, talk a little bit about those changes.
Sure. So, one of the biggest things that's happened in the last few years is the advent of Medicare Advantage. Medicare
Sure.
Advantage plans, as you know, become a comprehensive single door for physical needs for a consumer. And so when you have such a plan, there are over 750 Medicare Advantage plans today who offer home care as part of their benefits package. And, it doesn't take long for you to say, that makes so much sense. Because in Medicare, where used to be, the home care used to be available only through Medicaid. But
Sure.
what we found is that being able to keep a person healthy, even on an episodic basis, reduces total cost of care and provides for better recovery and longevity in the community.
The thing that I always hear as it relates to Medicare Advantage in the home health context is the margins are terrible, the reimbursement is garbage. And so if I'm a home care agency owner, what's that landscape look like? Why would I want to get in bed with a program that everybody on the home health side of the street thinks is terrible?
Well, first of all, the home health is a very expensive service. And
Mm,
the home care service, actually, for Medicare Advantage plans, is an opportunity to reduce the cost of care. So if
mm,
you think about it, a person is discharged from a hospital and home health is dispatched to provide them nursing as well as maybe OT and PT in their home after they're discharged from the hospital. However, what happens is those are 70, 80, $90 an hour services.
sure.
Whereas if you're able to dispatch a home care provider, a caregiver that is providing non-skilled services, that consumer in their home is going to be able to live more comfortably during the recovery period, but at a significantly lower cost, maybe
Sure.
closer to the $30 range per hour rather than the
Yeah.
$70 range. And
Right.
it actually humanizes their needs because what they really need are some uh, daily activities. They need help
Right.
showering and dressing and moving over to a comfortable place in their house. They don't need a nurse to be doing that with them. They may need an
Yeah.
occupational therapist to help them deal with their new conditions, but
Right.
they may not. They don't need a nurse for that.
So reimbursement at least sounds like it's in the ballpark, right? It sounds a little bit above Medicaid in most states,
Mhm.
probably a little bit below private pay. But these are also consumers who may have the resources to be able to pay, out of pocket for some level of care, and it could be a good lead gen opportunity for agencies.
Absolutely. It's a significant opportunity for agencies to introduce themselves to families who may need long-term supports with
Sure.
mom or grandma, who recognize that in order for an elderly person to live as independently or as long as possible in the
Yeah.
community, they need minimal supports that help them stay
Yeah.
healthy.
No, makes perfect sense. Okay, if someone's listening to this and they're thinking, "Okay, seems a little interesting." What's the first step for them to figure out if adding, becoming in network with a Medicare Advantage plan in their market would make sense for them?
Contact them. Medicare Advantage plans do just like Medicaid plans. They have
Sure.
networks, they have
Yeah.
providers, they have credentialing processes, and they have contracting. And what I've found is in a few areas that I've been involved in, we're able to actually bring some total value-based contracting into those settings in a
Mm,
very meaningful way because now the Medicare Advantage plan can find ways to reduce total cost of care. So contact your Medicare Advantage provider, reach out to them, introduce yourselves, just like you would do with an MCO on the Medicaid side.
yeah. And the thing that strikes me, just in terms of, you said there's 750 plans who offer this benefit as a part of what they do. That's a lot of plans that exist. And one of the things that I consistently hear is, of course, there are large national providers of Medicare Advantage plans, but my understanding is also that there's a lot of smaller regional providers who are easier to start a relationship with because they're more local to your community.
Sure. And, one of the things that you'll find is there are usually local health systems. I
Sure.
live in the St. Petersburg area, Florida, and we have a local plan called Baycare.
Yeah.
Contact Baycare. They're a local plan. They're focused on serving local needs. Their zip codes and their demographics are well known, so they can recognize. And you can find that information about them on their website. You can determine whether they're already offering a service or whether you want to approach them in a way to help them enhance their service packages,
Sure.
which might take a while.
Right. Makes sense. Well, Fady, you are somebody, not to give your whole bio or anything, but has been on the operator side, in a large family caregiver agency, Medicaid payer profile. You've worked with providers, you've worked with payers, bringing value-based care into skilled, non-skilled, a lot of different contexts. So you've had a lot of success, and I bring successful people on this show, but not to talk about any of that, but instead to ask the question, what's the biggest mistake that you've made in your career? And how did that change the way that you think about your business?
Well, the number one mistake that I think I made is considering that all people who receive home care are homogeneous. They're all alike.
Sure.
And one of the probably the most important things to remember, like any other marketing activity, is that we need to understand how consumers are different,
Sure.
whether they live in rural areas, in urban areas, their level of income, as well as a lot of cultural differences that exist in the people we serve.
Yeah.
And we find specifically as you're thinking of the Medicare population, there as it's getting older, they come from have a variety of expectations. One of the interesting things, I had a nonprofit Medicaid provider who decided to want to expand into the Medicare side, and they're very excited about it. But they tried
Sure.
to deliver the exact same service as they
Right.
were doing in the Medicaid side. Well, what they learned very quickly, what we learned very quickly, is that we need to adjust. You need to change what you do. You need to provide significant understanding of the new population you're serving.
Yeah.
Also happens when you're dealing with the differences when you go from state to state. Uh,
Right.
I worked with agencies that operate in multiple states, and you find that they really need to adjust their approach. They need to recognize not just north and south and ethnic backgrounds and so on, but you just the speed of life and
Sure.
and where we were together in California. The pace in California is very different than my New York clients, and so
Right.
we need to really recognize that those differences are very important, and to spend
Sure.
the time to understand them before you start delivering the services.
Yeah. I think that that rural versus urban distinction is a pretty significant one, and that even changes. You can have a, let's call it, small mid-market city of 150,000 people, and you want to expand your service area out into the surrounding communities, and even that can be very different. And so, what did you find success with in terms of the kind of steps or kind of guiding principles to not make these assumptions about a new market, not, copy paste from one place to another, but understand that market, but also without reinventing the wheel? It feels like kind of a
Sure.
hard needle to thread.
Well, it is because remember that many of your processes as an agency need to continue to be stable. That's what's made you successful. The number one difference is to train your caregivers in a
Mm,
way that's responsive to their local market needs, so
mm,
that they understand, not because they tend to obviously live in those communities, so they can
sure.
respond to them. So if you've got somebody in Northeast Pennsylvania in a rural market, and you're an agency that started in Philadelphia,
Right.
you will use the same scheduling and dispatching and
Yep.
quality controls and all that you do in Philadelphia. So you're benefiting from that growth. But what you need to do is to recognize what that particular community needs
Mm,
And, we found recently that adjusting the training approach in that community is the number one method of responding to such a change. And to recognize that you fit in because you fit in. You fit in not because, or you're successful, not because you're offering something that nobody else does, but that
right.
you're offering something that the community needs.
I think that's really well said. Also strikes me that you're going to happen upon some caregivers who become this kind of archetype of this is the kind of caregiver that we want to clone in this community.
Hmm.
And so there's an opportunity, I think, as you're offering that training to really like elevate some of your great caregivers to be able to say, hey, these are the people who do the best thing. We want them to be able to share
Yeah.
this, the way they approach this.
And, that's also a significant opportunity for a provider to create the ladder that most
Sure.
caregivers usually want, but have no way of achieving. I've had a couple of my clients have used that opportunity to turn what is a new area into an opportunity for somebody to become, first of all, either a surge capacity supervisor. They're able to step in when other folks are not
Mm,
available. They're able to go in and provide oversight and training. They're
right.
providing quality management tools to their caregivers. And so
Yeah.
we talk about the need to find ways to engage and retain caregivers in this business. This could be a very efficient way to do it.
Yeah. Well, and it's a way that fills such a like essential gap in the back office. Like we think all the time about, okay, we have to get leaner and more efficient in the back office. We can't just continue to add headcount. But there's also these kinds of expanding and contracting needs
Hmm.
for experienced, responsible, trustworthy, loyal people, but that, we don't necessarily want to take off the front line. We don't necessarily want to bring into the office full time. And these kind of flex roles that have a little bit more pay, a little bit more responsibility, it's a great way to signal to your caregivers there's a career path here, but also to gain some of this kind of flex capacity within the back office to deliver, extra administrative capacity, but without, increasing headcount and desks and computers and all that kind of stuff.
And it's consistent with what we all train in business school. Find peer coaches. They
Sure.
get people that do what you do to help teach the next group what they need to do and how you want to do it,
Yeah.
rather than coming in with just a policy manual. Say this is how you will do it. Have
Right.
peer coaches become much more effective.
Yeah, this is something people talk a lot about, and this has been brought up on my show before. Like, how do we create a career path for caregivers? And I think there's kind of this default of, well, there's this official career path for caregivers, which has become a CNA and continue
Mhm.
down the licensed pathway, and that's a legitimate route, but that's a route that so few caregivers ultimately take.
Mhm.
The impact is also that we lose some of our best people, which great, right? I want to see people grow and expand, but I think the question is for people who are not going to take that route, how do we provide a career path? And what you just shared is, I think, a really great way to provide opportunities for great caregivers to stay with the organization but expand in their responsibilities, and also a way to signal to the rest of your caregivers, hey, we're an agency that believes in the upward mobility of caregivers and the ability of caregivers to do more than they're doing today.
Sure, and especially when you're dealing with non-credentialed personnel,
Sure.
CNAs, whether home health aides or so on, you are dealing with individuals who need to be trained, but in a manner that they can respond to without feeling threatened by it. So that can be a very effective tool to use.
Wait, say more about that. I like what you just said, but I don't think I completely understood it.
All right, so you think about it, the show me method, right?
Sure.
So if I take somebody who's performing really well for my agency and make them a coach, they're
Right.
showing their peers in a non-threatening way what
Mm,
is the right way to do it. We've recently used that on something on the use of electronic visit verification, where there
okay.
was a lot of like uh, reticence to use EVV. Please edit
Right.
that out.
Sure.
When they, as you look at it, you will, you know, when a peer was able to demonstrate how to use EVV, they were able to complete it much in a much less threatening manner, as opposed to when you send in the supervisor from the office or bring everybody in for a 3-hour training and you say, this is it. And if you don't do it, these are the consequences. It becomes a much more friendly, user friendly way to deliver the message.
Mm. I like that because, I mean, there's of course going to be some agencies where they bring everybody together and they want to lay down the law and say there will be consequences if you don't blah blah blah. But I think there's also this kind of implied consequence when you bring in authority to show the thing. And so the peer model of here's how I do this thing, here's how you can do this thing feels much less threatening, which is something that we've not talked about before, and I really like.
Yeah, and
All right.
for those of us who are, advocates at base of what brings us to this industry,
Yeah.
peer advocacy is one of the most effective ways to engage folks, as
Yeah.
we've all learned over the years, and it's very transferable to the way we deal with caregivers.
Mm. Okay. Well, I want to transition to something that you find is underrated in the industry. It's generally overlooked, but you think it's really, really important.
Well, uh, I think it's customer service in the back office. We put so much energy as agencies on what we deliver in the home. We
Sure.
train, we supervise, we dispatch, and so on. However, when you really look at what engages consumers very well and provides continuity and loyalty to an agency, it's the way we treat them when they call in and they have a problem. And
Yeah.
they're usually calling in the customer service folks in a variety of roles. They may be a scheduler, they may be a supervisor. And I think the one of the areas that I find is we don't pay nearly enough attention to is how well we treat that consumer when they call in with a problem. We do
Mm,
a lot to treat the caregiver well when they are going to be late, when they have an issue in the home. But when the consumer calls up and says, I'm not getting what I need,
mm,
the tendency is to say, well, we'll get you somebody else, or we'll try to do better, but we don't really listen. We don't really take the time to understand what they're really talking about. Some of the more successful situations I've been involved in, where when they got a serious complaint from a consumer, they will dispatch a supervisor to the home. They will
sure.
actually do things that demonstrate that they are committed to taking care of that consumer's need. Whereas most agencies, unfortunately, want to put a band-aid on it and move on.
Makes sense. And I think one of the things that you pointed out there is there are a lot of different people in the office who could be picking up that phone.
Mhm.
Agencies at significant scale have got a dedicated phone line and people to answer those phone calls. But most agencies are going to have folks who are cross-trained to handle those kinds of conversations. They may be a scheduler or a recruiter or maybe even a marketer, and they're responsible for picking up those phones and saying, "Okay, I now have a frustrated consumer's family member on the line. What do I need to do?" And what I'm hearing you say is we shift really quickly into ending that conversation on a high note, but not really addressing the underlying problem, not really listening
Right.
to what the consumers actually got going on.
Yeah, and you think about like in business in general, we create very elaborate CRMs and ways to track how we resolve issues and so on. You rarely see that being done in this industry, which is a
Mm,
real shame.
mm.
A
So
great
there's a
opportunity. So
Right. Yeah, there's a tooling challenge here as
yeah,
well of where are our clients? How is the client health? Are we doing any kind of client health score? One of the things that I hear about all the time from kind of the private pay world is families making the decision to move a loved one into a community or a facility of
mhm,
some kind, and the home care agency is the last one to know.
mhm,
And obviously we started working together because you wanted to stay in your home for as long as possible. We've got a lot of ideas and have seen a lot of ways to keep people successfully in their home. And I think a lot of times the family will kind of swoop in and move that person into a higher level of care. And there could have been some stuff that we could have done previously. And so I think like when we think about, you know, consumer client health scores, there's like the satisfaction piece of this, but I think there's also the acuity piece of are we staying on top of and preventing the risk of that person prematurely going to a community, which is kind of the worst outcome for the business, but also not the outcome that that person engaged home care in the first place to get.
absolutely. And the interesting part is we've seen the forward thinking agencies, both in the private pay and the Medicaid side, and the Medicare, Medicaid side, actually use that knowledge in
Mm,
order to go to their payers and get enhanced payments
mm,
because they're able to now report on changing conditions. They're able to
sure.
help close care gaps. They're helping to avoid hospitalization or an
Mm,
emergency room visit, which the payers are very excited about. And
yeah,
so, you know, doing doing well while doing good
yeah,
is really appropriate for this kind of setting.
yeah. Um, I've talked a few times just because I'm at events that have home care, home health, hospice stakeholders, and everything I ever hear from the especially the home health stakeholders is they've got to be able to prove value. They know that this shift towards value based care, though slow, seems inevitable in a lot of ways. And there's some really forward thinking agencies who are taking advantage of these like shared risk payment models where there's economic upside if they deliver these kinds of outcomes because they're able to prove how much they've saved the payers and all that. And one of the things that's become clear to me is that home care, although not particularly involved in this at a lot of levels, is going to become more and more involved in being a stakeholder in this value based care continuum. And so, I mean, what are the kinds of things that home care should be able to prove in order to be set up well to engage in these kind of value based care, having the negotiation power to go to the payers? What are you seeing agencies have success with?
The number one aspect is we have eyes on the consumer much
Yeah,
more often than anybody else.
sure.
Right? We're visiting with them 2, 3 times a week.
Yeah,
We're observing them at their best and at their worst. And so we're able to really monitor and create the reporting for the need for intervention.
mm,
Because, you know, when you're looking at value-based care, and one of these days we'll do a whole segment on this,
sure.
that, you know, early parts of it is a process. So it's observational, it's reporting, and it's being able to approach your payer with, look, I'm collecting all this data.
Yeah,
Is it of any use to you? Or when I go in and I notice that my consumer is disoriented and she's not eating well,
mhm,
it's an indication. If you've trained that caregiver well, they can probably prevent a UTI
right.
or intervene early enough without having to send the individual on a Saturday night to the emergency room. So
Yeah,
when all they may need is an antibiotic. And
right.
so the ability to demonstrate to payers that you are collecting relevant data to them will allow you as an agency to demonstrate that you understand their pain points, as
Right.
opposed to approaching them, well, I need you to pay me $2 more an hour because
Sure.
blank, blank, blank. You say, hey, I'm going to save you money if I'm willing to share this information with you. Or
Yep.
what additional information do you need? Or, you know, how do we want to deliver it to you? So there's a lot of opportunity there for innovation, creativity that does really good things for the consumer.
Yeah. And then I think the tie-in for anybody who's in the private pay world and is like, why are we talking about payers? I don't ever talk to payers. Is your stakeholders in home health, especially, are you're one level removed from this conversation. They are having this conversation with that payer to negotiate for better rates, to deal with any kinds of questions or audits or whatever. And so the more that you can do to prove the outcomes you're providing that help them do their best work is going to make you such a valuable referral source over and above the competitors because most agencies, it's hard to collect data. You got to remember to collect data. Most people are not doing it. And so if you're able to present the story of, you know, we had this caregiver who noticed this thing in that client and we found out that we got out in front of a UTI. Um, that is, you know, a huge, huge value to any of the other stakeholders in the home-based care continuum.
And think about where we started this conversation, David, about where Medicare is going to be offering additional home care benefits to consumers.
Yeah,
And so as Medicare Advantage plans continue to offer additional benefits in this space, agencies that demonstrate that they can deliver this higher level of care will get better reimbursed.
sure. Makes perfect sense. Okay, let's transition to talking about, we talked about a big mistake that you've made in your career, but what's a little mistake that you see home care owners make all the time? And if they quit, it'd make their lives or their businesses like 10 times better.
Oh, we don't make mistakes, do we?
No, I haven't. Not a
I
single
haven't.
one.
Uh, the biggest mistakes that I find is, I'm sorry, the small mistakes that we can take advantage is to recognize the value of the lifetime value of our consumer.
Mm,
They're usually, but even in the private pay space or in the Medicare space, you've got when you acquiring a consumer is very expensive. Having them sign that first contract,
sure.
having them commit, and so understanding that there's a lifetime value associated with it,
Yeah,
treating the consumer as a long-term relationship as
sure.
opposed to an episodic relationship will allow you to really maximize revenues, build those community relationship as well as a reputation for being a well-centered, consumer-centered
Sure.
organization.
Yeah. So what does it look like when you go from, like let's call it like maybe a little bit transactional in your approach to consumers to really recognizing the lifetime value of that consumer? What changes?
What changes is you become responsive to their needs. So
Mm,
you're not selling them, but you're offering them supports that they need. And think
yeah,
about it. If you, as we serve mostly elderly people who have something that starts this ball rolling where they
sure.
need additional supports, very few of them are going to get a whole lot better. So
Right.
over time, they're going to need different types of supports. There are going to be some things that their health plan will pay for, their insurance will pay for, and some things that the family will pay for. So
Mm,
recognizing that there are multiple possible ways to support this consumer early on, and then keeping track of them, making sure that we talked earlier about agencies that use a CRM tool
sure.
that actually recognize that, hey, Jane was with us a year ago for 2 weeks. Jane is back.
Yep.
Now Jane has these different needs. Going into the relationship, recognizing that that individual is the same individual and you're
Right.
able to support them. And I think you'll find that the families will come back to you. They'll
Yeah.
tell their friends and their community about you. And that becomes the lifetime value that you can really capitalize on.
Yeah. Well, and this comes back to something that you mentioned previously of all this comes down to, did we train our caregivers to recognize the lifetime value of the consumer? That might not be the language that we use when we're training caregivers, but it comes back to, if all we are doing are the ADLs that are on the care plan, we are providing an appropriate minimum level of service, but that's not the kind of thing that people are going to talk about in the community. Whereas, if there are people who with the right supports could continue to do some of the things that they've always loved to do: art, music, baking, going on walks. Those are the kinds of things that might not be explicitly written out on the care plan, but that really well trained caregivers can identify with the right buy-in, can identify and can help their clients do.
Yeah, absolutely. And recognizing the humanity of where we talked earlier about a person who uses a wheelchair and how
Sure.
you might treat them, you know, come full circle when you're sending a caregiver in somebody's home.
Yeah.
They've actually reached the point where they need more than just the communication because that you may be their companion for a few hours during the day. You may be the person that goes with them to see their doctor
Right.
that's able to really support the family, not
Yeah.
just the person that you're there with.
Yeah, makes perfect sense. Okay. Well, we've talked about a lot of mistakes and stuff that went wrong, but I like to end every episode on a high note. So tell me about something that's happened lately in your business that you're proud of.
Well, in my business, we've been focused on two areas: helping agencies capitalize on value-based payments and
Right.
value-based care. And we find that an increasing number of providers are learning and growing in that area so that they can actually negotiate better rates. But also, we found that there are increasing number of agencies that are offering a bigger continuum of care. So they might
Mm,
offer the skilled nursing at one point, but they also supplement it with significant non-medical home care. We're excited when we see agencies grow in that, add
Sure.
services that families need, and allows them to really approach insurance companies and payers. Because,
Mhm.
in the Medicare space, we're seeing that those are payers in the same way that we
Right.
think of in the MCO sense. So that's been a really fun thing to watch and help our clients work through.
That's great. Well, before we get out of here, what would you like to plug?
Well, there are two things that, as being an advocate first organization, Extra Globex publishes two tools. We have the value-based payment blog, which comes out a couple of times a month. And we've recently starting to focus on the dual eligible population.
Sure.
There's about 15 million dual eligibles across the US today, and we're seeing them increasingly important to managing total cost of care. So we have the dual eligible headquarters newsletter and resource center, and they're both free. Please go to our website and sign up for them.
Yeah.
Share them with your friends, and if we can help you in any way, call me.
Sounds great. Well, Fady, thank you so much for coming on the show today and really enjoyed it.
Thank you. Same, David. We appreciate being invited, and good to see you again.
Good to see you. On behalf of the team here at Zengage, thanks for listening to the show. We'll be back next week with another episode, so be sure to subscribe wherever you listen to podcasts on Spotify or Apple or YouTube. Leave us a rating while you're there. It helps other people find the show. If you have comments on the show, drop me a line, david@zengage.com. Would love to hear from you, chat with you there.